Sri Lanka is fast entering the global village. As with every transition, this poses its own set of challenges as well as opportunities.
Sri Lanka has achieved tremendous results in terms of the MDGs, in terms of dealing with communicable diseases. Couple of years ago, Sri Lanka was declared malaria-free.
Sri Lanka, we have a pluralistic kind of a health system. We are very strong on primary health care. We have a network of public health institutions working on preventive health care, as well as a network of healthcare institutions. For each 3 kilometers, you find an institution which work on curative care.
Our society is moving from a low-income country to a middle-income country. So naturally, the lifestyles are vastly changing.
Over the years, Sri Lanka has faced an increased health burden in the form of NCDs or non-communicable diseases. In Sri Lanka, NCDs amount to about 75% of total deaths. And in fact, 18% of all deaths between the ages of 30 and 70 are attributed to non-communicable diseases. Unhealthy lifestyles have led to an increased number of patients suffering from diabetes, cancer, and chronic cardiovascular and respiratory diseases, among others. It should also be noted that the consequences of inaction to combat NCDs are at a great cost to the economy, community, and nation at large. The current situation, however, is not entirely one of inaction.
Already on tobacco, we have taken the necessary actions. That is, we have started the pictorial warnings 80% in the cigarette packets. Then no smoking in public places. Then no advertisements.
The national response to NCDs include an operational NCD unit within the Ministry of Health and focus national policies on better physical health, eating habits, and alcohol and tobacco consumption. These efforts also include action plans to promote healthy living in order to prevent NCDs.
We have started some programs earlier as well. Everyone should have one sport in their life. Actually, that is what we wanted to emphasize in the school level. That is what we wanted to implement in every part of the country.
අපි බලාපොරොත්තු වෙනවා මේ තුලින් දරුවන්ගේ සෞඛ්‍ය වර්ධනය ඇති වෙයි කියලා උදෑසන මේ විනාඩි 10ක් වැනි කාලයක් තමයි අපි ගන්නෙ. ඉතින් ඒ තුලින් අපි බලාපොරොත්තු වෙලා තියෙන ප්‍රතිඵලය ලැබිලා තියෙනවා.
Closer analysis shows the main causes of NCD-related deaths as tobacco smoking, alcohol consumption, unhealthy lifestyles, and poor eating habits.
We see a lot of use of pesticides, chemicals in our diets. We see asthma and allergies increasing. We see what we call chronic obstructive pulmonary disease or COPD, mainly a disease of smokers.
Many of the people in the rural areas, due to the lack of entertainment, they started sitting in front of a television from 6:30 till 10:30 in the night until all the dramas are finished, and then they go to sleep and they have food while watching television. There's no movement. It's a sedentary life, and these people are used to working hard.
We are depending on the commercials which we are getting for our channel. So most of the advertisements based on fast food and many other attractive food items and all.
How then do we cultivate better practices among the masses? In October 2015, the joint mission of the UN Interagency Task Force met with key officials in Sri Lanka to discuss the prevention and control of NCDs.
What the 2011 political declaration says very clearly is that we need a whole of society and we need a whole of government response to tackle non-communicable diseases. And the same is absolutely so for the United Nations systems. We need the whole of the United Nations systems to come together.
The purpose of this mission is to establish a whole of government, a whole of society, and a whole of UN approach for the prevention and control of non-communicable diseases. A second objective is to establish a coordination mechanism to monitor and evaluate the progress towards prevention of non-communicable diseases.
This visit by the UN Task Force involved a series of meetings and discussions of the issues relating to NCDs with officials from various sectors, from policymakers to businessmen. The conversations went on to further stress the need for involvement at all levels in order that effective changes can be made to the country's current NCD crisis. The mission went on to engage all possible development partners to stimulate their interest in support. The need for a collective effort and in turn a multi-sector action plan is probably the most essential part going forward. This action plan must call on all stakeholders, including government, civil society, the private and public sectors, academics, donors and even the media. It is paramount that they coordinate their efforts and work in collaboration for the program to work and help reduce NCDs and NCD-related deaths.
But now they have to move out of the healthcare boundary to address risk factors beyond.
Goes beyond health. We are giving our maximum support and would like to participate, but we need that direction, commitment and leadership above all things.
We are not taxing tobacco and alcohol enough. In fact, we are taxing very low compared to the actual real cost of this.
There is a huge need for information dissemination and creating that awareness, particularly among the younger generations and across the population. There again the private sector can do a lot of work.
So we can assist jointly in things like prevention, awareness.
The change has to come from within, from each of us, you and me, and our children, our families.
The joint mission recommends that the government, the UN system and other stakeholders prioritize and implement a selected set of internationally accepted, cost-effective and feasible interventions in order to maximize the impact of NCD investment in Sri Lanka over the next 2 years. A high-level coordinated mechanism is recommended to facilitate and to monitor actions of different stakeholders.
This will be a time to transform our agenda to make sure that no one is left behind.
The prevention and control of NCDs in Sri Lanka cannot be a standalone effort. The task force, the government, health officials and the private sector must come together to collectively advise and educate the country's populace from school to workplace and from home to community center, creating a supportive environment for a healthier, cleaner and more informed future.